Good afternoon and welcome to the PowerPoint, the criminalization of mental illness. Let's begin. So the beginning. The criminalization of mental illness. So in order for us to understand and talk about what's currently happening in the United States and across the world, we first need to talk about how criminalization of mental illness began. It seems throughout history there was very little talk about mental illness, but when it started to become present through society, they did not have an understanding of mental illness, nor did they have a way to deal with these individuals. The thing is though that yes, we started seeing individuals being treated as criminals, but it started with them being treated as subhumans, having no rights. So, and this started in other countries, and United States, of course, had followed, suit in how these individuals were being treated. But it, of course, started in other countries since we are a relatively new country. Even though we have come through rough beginnings on how individuals with mental illness were being treated, we still have not made a significant amount of progress towards change. So in this PowerPoint, we'll be addressing certain topics, which include specific concerns that we have in the United States regarding the criminalization of mental illness, addressing what kind of changes have been made so far to combat the current issue, the problem with police responding to mental health calls, possible solutions from mental health courts, how the problem is within other countries, as well as how modernization of the Mental Health Act is going to affect people with mental illness. So police responding to mental health calls. So the statistics are as follows. 1,194 individuals were killed by police in 2022. And this was the highest amount of killings by police officers in the last decade. 97% of those individuals were shot to death by police. Out of all those cases, only 9 cases in total, which totals 1% of all cases, were where the officers were charged with a crime. Out of all the killings, most of the killings, which amount to 597 individuals, involved a situation where police had responded to where the suspect was either a nonviolent offense or there was no crime being reported at all. Out of all those individuals that were killed in 2022, 110 individuals were killed by police officers where the police officers were responding to a call where the individual was having a mental health crisis or behaving erratically. Over half, which amount to 637 deaths of the killings by police officers, were traffic stops, police responding to mental health crisis, or situations where individuals not threatening anyone, including the police with a gun. Those 55% that were killed, if there was alternate responses to the situation, then it would not have resulted in that individual's death and could have reduced last year's violence nationwide. Here we're going to look at some case examples. The case of Ervo Otino. The first incident that we're going to be talking about involves individual Ervo Otino on March 3rd, 2023. There was a report that there was a possible burglary and police have responded and encountered Otino. The police officers and the crisis team had placed Otino in emergency custody order, and as a result of this, Otino was taken to a hospital where authorities had claimed he became physically assaultive towards staff and officers. There, he was taken to Henrico County Jail, but 3 days later, he was taken to the mental health facility in Dwindle County, where Otino had died during the intake process. There was a claim that Otino had become combative and was physically restrained during the intake process on March 14th. In the video provided by CNN, Otino struggled on the floor, and that was when 5 more officers and facility workers had moved in to pin Otino to the facility floor. Otino did become responsive, and there was a total of 3 minutes that had passed before anyone had made an attempt to perform CPR on Otino. And keep in mind, this was all while his limbs were still shackled. CPR had continued for close to an hour before he was pronounced dead at the scene. As a result of this, 7 sheriff deputies and 3 hospital workers have been charged with second-degree murder in Otino's death because it was a state-run mental health facility. The case of Jada Johnson. On July 1st, 2022, Jada's grandfather had called 911 and had told police that his granddaughter was having a mental health crisis and needed help. No one knew that by calling the police, Jada would have been shot 17 times by police officers in front of her daughter and grandparents. Jada did have a handgun on her, but it was not pointed at the police or anyone else around her. It was pointed at her own head. She was not a threat to anyone but herself, and she was recently discharged from the hospital on July 1st, but she was still drowsy from the sedative, and by 9 p.m. that night, she had called 911 several times complaining that her ex was coming to kill her. About a half hour later, her grandfather had called, and 3 Lafayette police officers had shown up to her home with the intention of arresting Jada for making fake 911 calls. Sometime later, during the talking between Jada and the police officers, Officer Rugg had tackled Jada and in the process had grabbed her hand that contained the pistol, pinning it to the ground. Officer Broom had shot Jada 6 or 7 times. The other officer, Rugg, had done nothing to stop the shooting from happening or continuing. The two officers had radioed back to base saying that they needed backup while Jada was still on the ground bleeding and immobile. That was when she was shot 9 to 10 times more. Some possible solutions to police responding to mental health calls. So one option is more training for police. There are two current programs being offered, the Crisis Intervention Training and the Mental Health First Aid for Public Safety. So the Crisis Intervention Training is an approach, teaching them how to approach the situation, responding to calls where individuals having mental health problems. And it emphasizes on officers understanding the mental illness and incorporate the development of communication skills, practical experience, and role playing. The mental health first aid for public safety is designed to help understand mental illness and addictions and providing them with effective response option to de-escalate incidents without compromising safety. The participants that are taking the course will be able to, quote, identify the unique risk factors and warning signs of mental health problems, build an understanding of the importance of early intervention, and most importantly, understand how to help someone in a crisis. Mobile mental health crisis teams. The crisis team that's going to be dispatched when someone calls 911 or 988 or the non-emergency police lines. When the crisis team is on scene, they will assess the situation and in collaboration with cahoots, instead of having law enforcement on the scene, where they will try to build a rapport with the individual and provide on-the-spot counseling and de-escalation, or transport the individual to a local emergency room that has a psychiatric service if deemed necessary. If the crisis team is able to get the person to come willingly, it's always volunteer to the hospital. Then once with the hospital, they will make the handoff by sharing any pertinent information with the hospital staff. Some of the other options include grief counseling, wellness checks. They are trained in basic medical care. They carry Narcan, other prescription medications that can reverse opioid overdose in the event that they arrive first on scene. Some alternatives for when mental health individuals are involved in the criminal justice system. So one is to defelonize mental illness. So Virginia is having a major problem where individuals are becoming felons due to how they act when they are having a mental health situation and the police are responding. So these officers are potentially entering dangerous situations and are not mental health counselors and are responding to calls in the only way they know how. So which in turn means that they are equating the situation to a cornered and sane criminal. So by defelonizing mental illness, it would mean that individuals who are having mental health crisis it would mean that they would get the help that they need rather than potentially being shot and killed in the call by the police. So currently the law states that anyone who is convicted of attacking police in Virginia is guilty of a Class 6 felony punishable up to 6 months in jail. If this goes through, it would mean that you would have to validate a genuine mental health crisis claim to set aside felony charges, including medical evidence and expert testimony under court. Another thing is mental health courts. The main reason why mental health courts were established is to reduce the length of time in jail or prison for offenders with mental illness by using community-based treatments as an appropriate alternative to incarceration, improve the court's ability to identify, assess, and monitor offenders with mental illness by giving the courts the tools to perform assessments, identify the appropriate treatment, and provide judges the tools to make more informed decisions in cases that involve mental illness. The main key principles of mental health is to try to target the specific population, in this case, individuals with mental illness. Referral, screening, and assessment, individualized treatment plans, informed choice, and voluntary participation, linking the individual to community-based services, and judicial monitoring and motivated compliance and evaluation. So, how these problems are being recognized and solved around the world. So, in Britain, under the article Mental Illness and the Provision of Mental Health Services in Prisons, they believe that using the acronym STARE, which is Screening, Triage, Assessment, Interventions, and Reintegration, is a necessary part towards getting people the mental health that they need in prison. It should be offered in the early stages of the criminal justice system, starting with screening at receptions, then moving to primary and secondary mental health care, mental health services when they're transferred to prison while they are achieving, remission in jail. One significant thing that they talked about in this article was that they have found that 34% of prisoners who had mental disorder were transferred to a hospital to 14 days in suburban areas, but in some rural areas, they were waiting up to 114 days to get a hospital bed. In Canada, under Exploring Mental Health Related Calls for Police Service, a Canadian study of police officers as frontline mental health workers. This took place in Ontario, Canada, where they looked at calls from 170 officers between January 1st, 2014 and June 15, 2014. There was a total of 400 calls that included mental health issues, and they have found that the police officers were ill-equipped to handle these mental health calls and that there should be more training regarding mental health and which should involve the ability to intervene when an individual is presenting with self-harm behaviors, the ability to respond to youth who are having mental health crisis, and respond to ethnic minorities in a mental health crisis. In Sweden, the Integrated Care for Individuals with Mental Illness and Substance Abuse example of coordinated individual plan in Sweden. For this study, they were looking at a small group of 25 case files in Sweden under the Swedish CIP. Their findings have found that there was a low to moderate collaboration and poor inclusion of interventions as well as the wishes of the individual mental illness. Under current Swedish law, it requires social services and healthcare providers to draw up coordinated plans for individuals to help improve the care process as well as create the users' involvement in their own care. And this study has shown that there needed to be a higher degree of collaboration between police department and community services related to mental health so that they can, get the specialization, if the case requires it. So the new law to modernize the Mental Health Act. So the Mental Health Act revision of 2020 is to try and modernize the Mental Health Act of 1983 in England and Wales. So these changes can be made towards the grounds on which an individual can be detained for assessment and treatment. Under the current Mental Health Act, it defines that individuals who have learning disabilities or autism are considered to be mental disorders and not disabilities in which they are, which in turn forces those individuals who have these disabilities to be forcibly detained as inpatients for assessment or treatment since their disability is seen as a mental disorder. Under the new bill, these individuals with these learning disabilities and autisms are still going to be seen as individuals with mental disorders, but they would not be a part of the new category of psychological disorders that are being determined to, be allowed if the individual has these disorders. Then there will still be a risk of forcibly detained for assessment and treatment. The other thing under this bill is that if an individual who has complex needs, they would have to be given an alternative mental health diagnosis along with the fact that they have learning disabilities or autism. S- So, as a result of this bill, when an individual who has learning disabilities or autism, they will unfortunately have a chance of coming in contact with the police in England or Wales, and the police will have no other option to detain them but under different legislation, which would mean criminal legislation. In turn, that means that individuals who are autistic or has a learning and disability could enter the criminal justice system in England or Wales unnecessarily and will most likely not receive the support that they need at the moment. The conclusion. So, what we have covered in this paper, we have addressed different topics regarding mental illness and how it's treated at the very beginning of the criminal justice system, all throughout the very end, in hoping that they can return to society. The problem is that the treatment of individuals who have mental illness is atrocious, and these individuals should not be treated like this no matter what stage they are in within the criminal justice system. The thing is that the police should not be the ones addressing mental health calls, considering that there's many individuals getting seriously hurt or dying at the hands of the police officers. And we did talk about other problems within the United States, but we did talk about some solutions that are being proposed across the country to try and solve these rising problems. Some of these solutions include the mental health crisis team responding instead of police, the option mental health court instead of regular courts to process individuals who have mental health issues, other treatments like treatment, rehabilitative programs, center, probation, community service instead of options for jails for individuals who have mental health issues. We also talked about how it is currently affecting other countries and what they have done to try to survey the problem and try to solve the problem at hand that's happening within their country. And even though these governments are trying to make some sort of change towards decriminalization of mental illness, there sometimes needs to be some sort of encouragement that generally comes from us, the general public. So, what can we do to encourage change? So, we can do things like contacting our state congressman, House representative, governor, or any other state official that can make or encourage some sort of change towards decriminalization of mental illness. This also means that we can try to get with some organizations like Mental Health America, NAMI, and the Office of Justice Program, among many others, to try to push for not only change but also awareness, making more people, aware of the challenges of mental health within the criminal justice system. Thank you for coming to my PowerPoint. Have a good day.